New year, new lockdown, the beginning of 2021, when the UK will go through the most dangerous time of the pandemic, to quote England's Chief Medical Officer, Professor Chris Whitty. We're in lockdown number 3, longer than number 2 last autumn, but not tougher than version 2 last autumn, but not as strict as the first one last spring. So what are the rules and what are the penalties for breaking them? And the Prime Minister has hinted that the rules may be tightened. The vaccine has started coming. Some have had it in Telford, while other people were offered jabs in other parts of the country. In a national NHS letter that was sent out over the weekend that no one here, not at the council nor the local NHS, was expecting. Schools are back to online teaching, apart from those who have to go in, and there are even lessons on the telly again, just like it was the case when I was a kid. I'm Chris Kowalik, and on your behalves, I'll be asking your questions to our panel on anything you want to ask, be it about the current COVID situation or anything else. And on the panel are some new faces and some familiar ones. David Evans, the Joint Accountable Officer for Telford and Wrekin and Shropshire Clinical Commissioning Groups, the CCG, which pays for health services locally. Simon Wellman from Telford and Wrekin Council, the Director of Education. Liz Noakes, Director of Public Health. Sophie Lane, the Revenue Service Delivery Manager. Nikki Minchell, who's from the Health Protection Hub and whose background is in public protection, and whose face can we not forget, that of Cllr Shaun Davies, the leader of Telford and Wrekin Council. Hello to all of you, and if I can begin with David Evans and Cllr Shaun Davies, and on this matter of the letters that went out, 4,400 of them going nationally from the NHS, but 4,400 into Telford and Wrekin, asking elderly residents to book online or on the phone for a vaccination that was then as far away as, well, the nearest was Birmingham, but then Manchester or even Bristol. You were both on Radio Shropshire this morning. You both outlined what the situation was then. Has anything changed since this morning?
Well, I'll start, Chris. And firstly, I think the really important message that might get lost in all of the chaos around the letter being sent is to our local residents, and that is that if you want to wait to get a local vaccine, then that is perfectly fine, and you can do that. And I know from speaking to a number of residents, particularly elderly residents over the weekend, that there was a real concern that if they didn't go to Bristol or Manchester or wherever, that they would miss the opportunity. And that's a really important message that I want to get across very clearly. You can wait, you can get a local vaccine, and those local vaccine sites, and I've been quite publicly frustrated by the lack of pace around this, but they are coming, and expecting some big news this week and next week and the week after as well. So we've literally left the station in terms of our journey to the vaccination. But it has undoubtedly caused concern, and that concern was compounded by the fact that locally and regionally we weren't aware of those letters going out. I think it is something that we do need the government to reflect on and make sure that those types of mistakes don't happen again. We saw it with testing earlier in the pandemic. Now we're seeing it on vaccinations now.
David, anything to add?
Just a couple of things, Chris, and thanks for that, Shaun. I mean, this is logistically a huge challenge. So the letters that went out, as Shaun has outlined, are an additional offer for people to be able to get the vaccination. They're not there to replace local provision, and we will be expanding local provision substantially over the next few weeks to enable more people to be vaccinated locally. But certainly it is an offer there for those people who feel willing and able to travel to other sites.
So where are vaccinations offered at the moment, and can you say where they could and will be offered in the future?
So currently within Telford, we have got vaccinations taking place within the Teldoc group of practices. We expect there to be a rollout of other sites within the next few days. That potentially could include Princess Royal, and it will also include other GP surgeries and other sites in the coming weeks.
And the news from this morning has prompted quite a lot of questions that have come in advance of this broadcast. So we'll rattle through all of those, and we'll start off on the subject of vaccinations and then move on to testing. For anybody that is housebound and can't get to a vaccination centre, what's the deal for them?
So this is probably not the most helpful answer for anyone in that situation. I make no apologies for that up front. At the moment, because of the constraints of the two viruses, both AstraZeneca and Pfizer, we are currently working out how to do that. Pfizer is not suitable to be given in an individual's home. The slight challenge we have with the AstraZeneca virus is the current guidance says that once you've given a dose, you cannot move the vaccine. So that would mean that for a vial of 10 doses, going into someone's home to give one dose would mean we would have to discard the other 9 doses. Now, clearly, when we're going through a mass vaccination program to try and maximize the number of people we can give the dose to, that's not entirely the most sensible use. Now, I think we will see further guidance coming out over the next few days. Clearly, we will end up in a situation where if that's the only possible way we can give a dose, then we will give a dose to a housebound person. But we would like to maximize the number of doses we can give, obviously.
But if you do that with the first dose, you're going to have to do that with the second dose as well, then with potentially the same problem.
That's absolutely correct. And as I say, what is clear is, and this was true with the Pfizer vaccine as well, is that as it's more readily understood the constraints about the vaccine itself, then that guidance may change. But as I say, at the moment, that is the current guidance. But the AstraZeneca vaccine itself only started getting used last week.
This is a question that's been asked, and I've seen this appear on TV channels. Can you choose which vaccine you have?
No, you can't. It will be whichever vaccine is being used at a site at that particular time. And the other thing is, the guidance at the moment is you can't change between doses either. So if you have a Pfizer vaccine first dose, you have to have a Pfizer vaccine second dose, and similarly with AstraZeneca. However, what I would say is there is very little difference between the efficacy of the 2 doses. So personally, I wouldn't be bothered about which vaccine I had. I'd be quite happy to accept either vaccine. Now, clearly, I'm not going to be vaccinated yet, and it would be inappropriate for me to be vaccinated. But I don't think people should be concerned about which vaccine. What's important is to get vaccinated as soon as you are called.
But the 2 doses would have to be of the same vaccine, would they? You can't
That's
have one
right.
of one and one of the other.
No, that is absolutely right.
So out of interest, what would happen if come several weeks down the line, I've had a vaccine of one manufacturer, and then when it's my turn to have the second one, it's not available? Then what would happen?
So what the advice from the chief medical officers is, and this was reinforced yesterday and reiterated yesterday, is in exceptional circumstances only, you could give, say, an AstraZeneca virus to someone who had Pfizer as a first dose. So in that kind of scenario, Chris, it is possible someone would receive a different vaccine for their second dose, but it is not recommended, and it is only in exceptional circumstances.
Great, thank you, David. Away from my questions and onto the ones that the public has asked. And Shaun Davies, Councillor Shaun Davies, will bring you back in because this is a repeat of a question of the last Q&A that we did just before Christmas, where the questioner asked about their 91-year-old mother and when was she in Newport going to be vaccinated. Since that question was asked and answered at the time, nothing has changed.
So Newport is an area that we're expecting some significant news over the next 2 to 3 weeks. We anticipate news in regards to that. Now, clearly, I don't know the details of the 91-year-old lady concerned, whether she's in the care home. That might change the position somewhat. I don't know what GP practice she belongs to, and again, that might change the position somewhat. So there's lots of variables, but in essence, the message I'm receiving from the NHS and the government is that we will be seeing 3 vaccination centres open over the next 2 to 3 weeks, which includes provision for Newport and surrounding areas.
And a further question asks if the Sturchley Health Practice has any of the vaccines yet.
So again, what will happen in regards to the central parts of Telford is that again, there's lots of variables, but again, I'd anticipate that if you are in the central part of Telford, that you would receive an invitation to TIC, the Telford International Centre, and we expect that to be open by the end of the month, from what I'm being told.
Another question asks, what if you're terrified of needles?
Probably one for David or for Liz to answer on this one, Chris.
So that's obviously challenging for the individual, and clearly we will need to be as careful as we can. Now, there's all sorts of things that you can do. For example, when someone goes into hospital, they have tried and tested techniques to try and reassure someone in relation to needles, and that is what we would do. And the other thing I would say is these are relatively small injections and relatively small needles. Now, that doesn't by itself make it any easier for someone to have the injection, but we do have tried and tested techniques. We have vaccination programs, for example, in terms of flu, with similar challenges for some individuals. The other thing I'd just like to say, Chris, very quickly, it's slightly off topic on this one, is I just want to reassure everyone on this chat and elsewhere, every dose of vaccine that is available and coming into Shropshire, Telford and Wrekin is being administered. So, you know, it is going to be a slow process to get round everyone, but we will get round everyone.
Question asking about the vaccination in the north of Telford, particularly Shaw, Birch, Admaston, Apley, saying that the Telford International Centre that Councillor Shaun Davies referred to just a moment ago is too far for some of them, especially if they don't have their own transport.
Yeah, so in terms of Wellington and the North Telford area of Telford and Wrekin, it's my understanding that there will be a particular site close to those communities. So it doesn't necessarily mean you won't be invited to the Telford International Centre, because clearly that's a very big site. And what I'm told is that at the peak, they will be doing 10,000 vaccinations a week, just to give you a degree of scale. So it might be that you're invited to the Telford International Centre, but there will also be, I'm told, venues very close to and within the Wellington area.
And staying on the subject of Wellington, a questioner who's 80 years old says she's vulnerable with kidney and liver disease and is having to shield. When will she hear about her turn for vaccination?
So I would imagine that she will hear within the next 2 to 3 weeks. We are committed to delivering the vaccine for all residents within care homes and for all of the over 80s population by the end of January.
And that leads to another question, which is the order of priority. So they're first, then what happens? And can you give us a timeline of that as well?
So we're working through the modelling work to see exactly when we can do the next cohort. So the cohorts that we are doing immediately are residents of care homes, over 80s, NHS staff and care staff as well. So those are the immediate cohorts that we need to get through. We're committed to doing those or having all of those vaccinated by the end of February, middle of February, before we then start to move on to the next cohorts.
Can I just say on this, Chris, because I've seen a huge amount of resident confusion and concern around this. It's not necessarily a case where one group will be done completely and every person in that category in Telford and Wrekin will be done before they move on to the next cohort. So sometimes for various reasons there are people who are in their 70s, for example, being vaccinated because what the GP practice will do is about making sure that no vaccine is wasted. So I've seen a number of examples on social media where people are aware of people who are younger than 80 getting the vaccine. I'm sure Dave will probably be able to give you the sort of the technical reasons for that, but that isn't against the rules as such. It is happening, and it's happening across the country. I don't know, Dave, if you can expand on that.
No, that's absolutely true, Sean, because as I say, if you look at the Pfizer vaccine comes in doses of 5. The AstraZeneca vaccine comes in doses of 10. We don't want to make sure that we use every available dose. The really important thing here is that we maximize the use of the vaccine and make sure that we vaccinate as many people as we possibly can. So clearly, if there is the odd 1 or 2 doses at the end of a vial, then it would be better to make sure that someone else gets vaccinated than waste that dose.
Going on to continuing with questions on who gets what and when. Domiciliary carers, where would they fit into all this?
So domiciliary carers would fit into the care staff, because this isn't just about care staff who work in care homes. It is about care staff who work across the whole of the care sector, including domiciliary carers. So they are in the same category as NHS staff. And actually, if I talked in just very specific terms for a second, in terms of the vaccines that have been given out across Shropshire, Telford and Wrekin at the moment, about 75% of those have gone to over 80s and care home residents. About 20% have gone to care staff, including domiciliary care, and about 5% have gone to clinically vulnerable NHS staff. We are changing that in line with the latest guidance, and when more vaccine supply becomes available.
There's a questioner who's worried that they might miss the call to have their vaccination. How can they expect that notification, and how would they be notified?
In most cases, it's by letter or by phone, but clearly if they fall into one of the risk groups and they've been phoned and there's been no answer, the surgery or booking centre will try and phone them again. It's not a case of one call and we don't call back. We will be calling to make sure people get the vaccine.
And Chris, this is very important, because it's been raised with me a number of times, particularly around parents who've got dementia or other medical conditions. And a real practical tip would be, with the patient's consent, is to contact your GP practice to offer a secondary line, telephone call line, or an email address. I know a number of GP practices are exercising that, because clearly, one example I had today was that a parent was really hard of hearing and just wouldn't hear the phone ring, and might not keep the letter safe when it came through. So a real practical, tangible thing you can do is just contact your GP, clearly with the patient's consent, just to add another telephone number.
Right, but fundamentally, let's just go on to this. It's going to be a letter or it's going to be a phone call, and I ask that because last week there was a warning that this council issued on its channels about a scam that was going around, text messaging people, clicking on a link, offering some money, I think, and they could go and buy their vaccination. So let's be absolutely clear: the channels of communication will be a telephone call or a letter. Yeah,
that's correct.
And Chris, again, just to be very, very clear, I know many people listening to this will know this is as an obvious, but it's really important that those phone calls will not ask for your bank details or your payment details or any personal information. So if someone rings you and asks for that information in regards to vaccinations, that's a fraudulent phone call. You should just put the phone down and alert the authorities. No, this is free, and nobody will need to give any bank details or any other personal information. It's really important, because let's just be very clear. People like that, Chris, should be sent to prison immediately, because they are preying on the most vulnerable in our society, the most vulnerable and scary time for many. And as a council, I know as a police force, we'll come down on those people like a ton of bricks if we find out who they are.
And we will go on to the subject of enforcement a little bit later on, but if there are any concerns about any activities going on that shouldn't be happening in relation to COVID, then you can either report it to the police on 101, or you can email the council at coronavirus@telford.gov.uk, and that email will go to our public protection team that we'll be hearing more of when we go into the area of enforcement a little bit later on during the session. Going back to the questions on vaccinations, and these are specific questions from people in specific areas of work and specific areas of life. Community carers, when will they be vaccinated?
So if they fall within the category of care workers, they will be vaccinated in the same cohort as NHS staff, so will be vaccinated by middle of February.
Vulnerable adults in their 80s who are not registered with TELDOC.
Again, they fall in the categories that we are currently vaccinating and will be offered a vaccination somewhere within the Telford area, as well as potentially obviously being offered in line with the letters that came out nationally over the weekend, but will be vaccinated by the middle of February at the latest. We're trying to make sure that we do all of those by the end of January.
Food retailers are classed as key workers, says this questioner. Why aren't they high priority to get the vaccine as well?
So the list, sorry, Shaun, do you want to go?
David.
So the list of key workers is prescribed for us in terms of who we can vaccinate. And unfortunately, at the moment, they are not within that category.
I was going to add to that there's actually a debate taking place nationally at the moment in terms of that sort of phase 2 rollout outside these 9 groups. So who's vaccinated first? For example, is a teacher vaccinated before a supermarket worker? Is an office worker vaccinated ahead of a factory worker? So all that debate will take place nationally. Clearly, we don't have any powers around that, and that will be a decision for government to make. But obviously, we have been pressing, and we continue to press to ensure that those people who are high risk, public-facing people, for example, teachers and supermarket workers, are at the front of the next wave of priorities.
And we spoke a moment ago about people who are housebound, bedbound, unable to go and be vaccinated. They can't get out. Similar kind of question in the sense of someone who has a neighbour who's partially sighted, not very mobile, can't get to the Telford International Centre, isn't very comfortable using taxis or public transport. What sort of help would there be for people like that who would need to be vaccinated and want to get vaccinated?
I think from Dave's point of view, in a moment or two, he'll talk about and maybe repeat some of the things he said about home visits, but also as a council, we are absolutely committed to ensuring that we do all that we can to support our residents to get to the vaccination sites, and equally for the NHS to make this vaccination programme work. So, for example, if there is ways in which we can provide transport through our fleet transport team or individual transport, then we will do that. All that resident needs to do or her family need to do is just make people aware when they book the vaccine appointment. I've been made aware of cases where a patient has said to their GP, look, I can't get to the GP practice, and the answer's been, well, we'll call you back at another time. That isn't what we want here in Telford Wrekin, and there's been a very clear message that we've sent out to all of our GP practices and our NHS colleagues that the council will do all that it can to support the vaccination rollout, including support with transport.
In terms of the vaccine going to GP practices, how has it worked? And who ended up getting it first, and possibly why? It is being asked by someone who's sent us a message while we've been on. Specifically, why did Teldoc get theirs and not other GP practices?
So with the initial Pfizer vaccine, the challenges around the Pfizer vaccine, and Teldoc started with the Pfizer vaccine, I might add. The challenge around the Pfizer vaccine is, one, how you can make it up and how far you can split the dose down. Pfizer vaccine has to be stored at -70 degrees. And originally, we thought that you could only deliver the Pfizer vaccine, and that was the guidance, out of a site that could store it at that temperature. As we've gone on, the guidance has changed and you can split it down, but the pack size, the smallest pack size you can split it down to is 75 doses. And a tray of 975 doses needs to be delivered within 4 or 5 days. Clearly, as a large practice, it's easier for Teldoc to do that than some other practices. That's why the AstraZeneca vaccine is so important in being able to roll out the vaccination program into smaller sites. That was the same challenge we had around starting to vaccinate in care homes. We could only start with the larger care homes where we could do 50 residents plus staff to make maximum use of the vaccine availability and doses that we had available at that time.
Can I also just add, Chris, because it's important in respect to Teldoc, just 2 points. Firstly, Teldoc has about 1/3 of over 80s in Telford Wrekin. So clearly, it's one name, Teldoc, but that is multiple practices that we have here in Telford Wrekin, which accounts for about 1/3 of our over 80s. And the second point is that Teldoc want to do more. There is red tape around their abilities to do more with patients that don't belong to them. I know that's being looked at urgently, but Teldoc really shouldn't be seen to be a villain in this. They've been really, really good. They've been first off the block. They're getting lots of patients done, and we're really proud and thankful to Teldoc staff and doctors there for doing that. What we want to do is ensure that that type of accessibility to the vaccine is rolled out across Telford Wrekin.
And finally, on the subject of vaccinations for now, this again has just come in while we've been speaking. It's been reported on Facebook today that you can book at Woodside without an invitation letter. Is this correct? And should we do this for our over 90 parents?
No, that's not correct. You have to be invited for a vaccine.
Back to the earlier point we made that you will be notified, you will get a telephone call, or you will get a letter.
That's right, Chris.
Right, so on to the subject of testing then. As a person who is still working with the public, how often can I get tested at the Place Theatre in Oakengates? I haven't got symptoms, but how often can he make sure that he hasn't got the virus?
So if I take that, so we have opened up rapid testing at the place. It is for people without symptoms, and what we're encouraging is for people that can't avoid going out for work purposes to get tested. And I would recommend that people get tested at least every 3 to 5 days.
And that's Liz Noakes, Director of Public Health with Telford Wrekin Council. I'm a cleaner who works in people's homes, and I came down with a sore throat, and I've been off work since Thursday. I should be in work today, but I feel better. I've got aches and chest feels tight, but none of the COVID symptoms. I'm off till Wednesday. Now my boss said maybe I should get a COVID test. Where do I go for one? I'm not classed as an essential worker. Is it back to the place again, Liz?
So actually she's displaying some precautionary symptoms, those wider set of symptoms that we as a local authority, or I as DPH, have recommended that she could get a test through one of the local testing centres by clicking that the local authority have directed her to get those tests. So she could book in the walk-in centres or the drive-through centres, as she is displaying some wider precautionary symptoms of COVID.
The questioner is an essential worker with the Samaritans. Will you be including Samaritans to your list of those who can order a test?
So in terms of people booking tests for a rapid test at the place, again, for anybody without symptoms, and that's, we think probably a third of people don't display symptoms. Before Christmas, we did work with a number of employers, and so we have a long list of employers at the moment, and it might be a bit confusing, but there is a drop-down list that includes asymptomatic Telford residents, and we're actually streamlining that process, so you should be able to book a test. You don't need to specify which employer or what have you.
And just remind us what web address that would be. That's telford.gov.uk/, is that Health Protection Hub?
No, it's not the Health Protection. It's on the main council website.
It's on the main council website, so we'll get that up in for you in just a second.
Thank you, Chris.
And that, I think, also then covers off the subject of testing. I'm just going to check to see whether we've had anything that's come in while we've been speaking, and there hasn't.
Chris,
so
while you do that, can I just, again, I'm sure that Liz and David and others will want to echo this. Our rates within Telford Wrekin are really, really high, the highest they've been since the beginning of this pandemic. They are huge, and I know, speaking anecdotally to friends and family of mine, they've noticed very quickly how their Facebook timeline is starting to light up with people who've got COVID in a way that just didn't happen before, and that is relevant to the fact that our rates are increasing. We are really lucky here in Telford Wrekin, and the work that the council and Liz and others have done around our capacity for testing. So if you don't display symptoms, you can go and get a test at the Place Theatre. If you are showing, as Liz has just described, precautionary symptoms, you can go and get a test through the government website. If you are showing the main symptoms, the classic symptoms, then you can go and get a test. And the turnarounds now around those testing are much more improved than they used to be. So if in doubt, get a test. They are free, and they will offer you that ability to know, and that's really important, as important equally as following the rules around social distancing, of course.
Liz, I think I saw your hand go up. Did you want to say anything there?
Yes, I just wanted to say, yes, indeed, the rates are increasing still within the borough. I mean, in terms of numbers of cases, we've now exceeded 1,000 cases in the last week. So we are in a really critical stage of this pandemic, and making sure that anybody with the virus, whether they're showing symptoms or not, isolates is absolutely critical, as well as making sure people that can stay at home. That is absolutely essential. I think there has been questions about, is it all about getting more people tested and that's why our rates are increasing? That is not the case. So what we do track is our positivity rate, what proportion of people test positive once they've been tested. And at the moment, at Christmas time, it was 5%, and now it's approaching 13% of those that come forward for testing are now positive within the borough. So it isn't just about the fact that we're increasing testing that our rates have increased. It is because more people now have the virus.
As Liz has brought in the subject of the statistics, we'll move on to that in just a moment. If you want to book a rapid test, the tests that are being carried out at the place in Oakengate, visit our website. No W's, it's straight into rapidtest.telford.gov.uk. That's rapidtest.telford.gov.uk. One more that's coming on vaccinations. What about the patients who have had the first vaccine at the Royal Shrewsbury Hospital and the second one has been cancelled within hours and has been postponed until March, they say? The patient has had a cancer operation, is 84 years old. It was a Pfizer vaccination first time round, and he doesn't know when the second one will be.
So we will be in contact to rebook him. The reason that there's been a change of the policy around the time for the second dose is clearly from a public health point of view, in terms of overall public health, the evidence is quite clear that by delaying the second dose gives us an opportunity to vaccinate more people. And in terms of both illness and unfortunately deaths, it is very clear from the evidence base that that is the right thing to do. So, you know, I'm really sorry that we cancelled people at short notice because I understand the inconvenience of that, but it is absolutely the right thing to do. Rest assured, he and others who've already received their first dose will be rebooked towards the 12th week from when they had the first dose, because that's what the evidence is showing at the moment, that there is no drop in the effectiveness of the vaccine over that extended time period.
We'll go into these statistics, and Liz Noakes has answered one of the questions in terms of the amount of testing done and therefore the figures that are coming out. But what is the excess death rate for Telford and Wrekin residents?
So in terms of the number of deaths we've had in Telford and Wrekin, unfortunately 149 residents have died since the beginning of the panic from COVID. But you can also understand that the excess deaths, i.e. the number of deaths above our 5-year average, has increased and was higher than the average in April and May and parts of June, and it is now starting to creep up in terms of being higher in terms of a percentage.
How much higher are infection rates in the 7 hotspot wards around Telford compared to the overall rate for Telford?
So in terms of hotspot wards, what I would say now is that rates are high across the whole of the borough. They were last week, but I highlighted 7 wards where the rates were the highest. But in terms of our rates now, they are high across the borough. We have 25 wards that have rates of between 400 and 799 per 100,000, and two wards with rates of above 800 per 100,000. So in terms of hotspot wards, it's more like rates are high across the whole of the borough now in terms of the position.
A further question on areas of the borough. Can you identify in which areas of Telford the number of people who have died from COVID?
We do have postcodes, but in terms of 149 per residents, that's since the beginning of the pandemic. So we don't tend to do that analysis. We tend to look at the current infection rates in terms of ward level information.
What are the flu infection statistics for last year compared to those logged as COVID infected, and how do those flu rates compare to those when it was without COVID the year before in 2019?
So in terms of flu infection rates at the moment, we don't have any cause for concern. I'm looking to David as well there, but we don't have a particular cause for concern in terms of flu infection rates in this current season. What I would say is that uptake of flu vaccine has been much higher than last year, which is a really good thing. And equally, all the measures that we're taking in terms of COVID, social distancing, etc., will all help to reduce flu in a similar way. I think David wants to come in as well.
Thanks, Liz. I mean, I just wanted to add on that. We knew the COVID vaccine was coming, but the NHS and partners put a lot of effort this season into making sure that we vaccinated as many people as we possibly could before the COVID vaccine became available, because we knew that there had to be a time gap between the COVID vaccine and the flu vaccine, and we didn't want to get stuck into a difficult situation where we were trying to give COVID and flu to the same individuals and lead to delays in one or the other. So huge amounts of effort were done by GPs and others in trying to make sure we vaccinated as many people as possible.
If I can just throw this in, I know Councillor Shaun Davies talked about this. I think you talked about this at the Cabinet meeting a few days ago, Councillor Davies, and this is in relation to the administering of the COVID vaccination. And when I had my flu jab over the years, I worked in the private sector, and a private company came and gave me a jab. When I worked for West Midlands Ambulance Service, there were paramedics who were assigned to giving the flu jab. Why isn't that sort of similar scenario being used to bolster the numbers of those who can give the jab when the stocks really do start to come in?
I'll just pick that up, and there's a couple of other points I want to make following the conversation just now. I mean, I think there is some frustration amongst particularly community pharmacists, for example, who feel that their skills could be utilised. And I know I was speaking to a midwife who lives in the same street as me, who says that it's a very from a medical point of view, it's an easy vaccine to administer. I think there is going to have to be a change in mentality around who can give the vaccine, and there needs to be a real call up to all those professionals who can do it. Clearly, I couldn't do it, but there are lots of people out there that could do it with some training. I think the caution has been around how the vaccines are handled and the particular training around that. And so I think as time goes by, as we evolve, that will happen. But can I just make 2 points, Chris? Firstly, in regards to the question on flu, because I don't know whether the questioner was coming from this angle, but I have seen this being posed on social media, that this is just some big flu outbreak. If you want to just get that into context, there's some fantastic illustrations of how busy this winter is compared to others. This is a winter like no other winter ever in terms of the pressure on the NHS, and you only need to look at people who work in hospitals, nurses and doctors, to be able to tell you about the immense pressure they are under. You only need to look at the scenes on the BBC 6 o'clock news in intensive care units across the country, and we shouldn't take for the fact that the NHS is responding relatively well at the moment under a huge amount of pressure as if this is some type of run-of-the-mill exercise that happens every winter. That clearly is not the case, and I don't know whether the questioner was coming from that point of view, but I have seen that type of question asked. And in regards to excess deaths, again, I've seen this raised as some type of suggestion that actually excess deaths aren't as high. They are significantly higher, and also the evidence nationally is starting to show that actually excess deaths aren't just about people who die of COVID, but also those people who are dying from other conditions because they can't access healthcare services for particular cancer care. So this is really, really serious, and whether you believe in COVID or you don't believe in COVID, this is having a direct and real impact on our health service here in Telford Wrekin across the country. And I saw a statistic in London about ITU beds being filled up. Now, you might be on the way home from work and involved in a car crash. You will need an ITU bed. the fact that the ITU is filled with COVID patients means that will have a direct impact upon you. So it's in everyone's interest to drive these COVID numbers down and try and get people well and out of hospital, because while our hospitals are full with COVID patients, that means they're not doing other things like elective surgery and cancer care.
David Evans from the NHS Clinical Commissioning Group. Chris Whitty, in his round of interviews this morning, has said the NHS is facing the most dangerous situation that anyone can remember. Locally, could you just paint us a quick picture of what the situation is for SATH, for the Shrewsbury and Telford Hospitals Trust, for GP surgeries and all the other arms of the NHS?
Yes, thanks, Chris. And I completely concur with what Chris Whitty and others have said today. This is a very, very difficult period. And whilst we may not be in quite as bad a situation as some other places like London, it is undoubtedly getting worse locally, and we expect it to get much worse over the next few weeks. So just to put some context around that, we are cancelling elective surgery at Robert Jones from this evening so that we can free up some anaesthetists to work in SATH to help increase the critical care capacity and ITU capacity at SATH. We will undoubtedly be making decisions around cancelling other services over the coming days to make sure that we have enough beds, both within SATH and also within Robert Jones and within our community settings as well, to make sure that we can cope with the increasing number of admissions. We've certainly seen increased admissions with COVID over the past 2 weeks since Christmas. We expect that to continue rising. And whilst we're not yet seeing the high numbers of patients who needed intensive care locally, over the past few weeks, undoubtedly we are seeing a greater number of patients, and because they don't require quite so intensive care, they are staying in hospital for longer. So the number of beds we have available is lower than we would like it to be.
We've had quite a few more questions come in on the subject of vaccinations over the last couple of minutes. We'll try and rattle through these as quickly as we possibly can. Contractors for Telford and Wrekin Council, can they? I think what they're trying to ask is, can they jump the queue?
In terms of testing, we've made the offer available to Ida Verde and Veolia for their staff to be tested at the Open Gates site, and they can do that whether or not they're a resident in Telford and Wrekin. In terms of the vaccine, as I said earlier on, there will be a debate, won't there, nationally, and the government will have to decide in what order the second phase of vaccination takes place. Now, clearly there's a huge amount of call on that. So there are teachers, aren't there? There are shop assistants and shop workers, there's police officers, there's soldiers, there's firefighters, there's a whole range of key workers in that. And clearly what the government will need to do is make that decision. Now, if we do get to the target that the Prime Minister has set of 2 million vaccinations a week as a country, then hopefully we'll be able to get through those numbers very, very quickly. And that's absolutely has to be our aim. And I think that Keir Starmer has said that we ought to aspire to be the first country in the world to vaccinate our population, and that absolutely has to be our national priority.
On to testing kits, self-testing kits. Can the council make it available to delivery drivers, bus and taxi drivers?
Sorry, rapid testing at the place is available. It's not home testing kits. It is rapid testing that you need to book online, as we've described before.
Righto. So it's straight onto the web. It's rapidtest.telford.gov.uk. Nikki Minshall, I think you wanted to say something on that one.
Yeah, just picking up on the taxi drivers, we've already invited all our taxi operators to send their drivers along to the place to get rapid testing, and we issued that invite last week.
Why aren't police officers being classed as frontline workers and therefore get priority? David, you can just speak. You haven't got to put your hand up. Just speak.
Chris, can I make a couple? I will answer that point specifically, but I want to make a more general point around, everybody would like the vaccine, wouldn't they? We all would. but we are following the guidance of the Joint Committee on Vaccinations and Immunisations. They've been really clear around where they think, in a sense, the biggest bang for buck goes in terms of protecting the population. So that is care home residents, it is over 80s, it is then moving down those various groups. Now, as Shaun's already said, I think we will see further guidance coming out over the next few weeks around key workers and what constitutes key workers in terms of making sure they are vaccinated. All I can ask is that people are patient. We would all like to get vaccinated, but it is about trying to make sure we protect the most vulnerable in our society as a priority, and we will do that.
Someone else who is asking when they'll get vaccinated is someone with very severe asthma, but they're in their 30s.
So they will come within, I can't remember exactly which cohort they fall in. I think they will either fall in cohort 4 or 6, because there are 10 different cohorts. They will be done before, if you like, the rest of the general public. I can't give a specific date on that yet. The commitment originally given, which we will, I'm sure, stick to, is that all of the 10 cohorted groups will be done within the first 12 weeks of the vaccination programme. So that's broadly by Easter time. So I would imagine they will be done towards the end of February or at some point during March. But that's the best I can give at this stage.
It's still on the same vein, unfortunately, David, but how will third sector workers get vaccinated?
And again, that will come down to where they fit within the key worker schedule, and or whether as individuals they may fit within one of the 10 cohorted groups. But we will be doing everything we can to vaccinate as many people as possible in line with the guidance and the recommendations around JCVI.
My adult daughter, who has learning difficulties and wouldn't be comfortable attending a vaccine appointment alone, would I be able to attend with her, or isn't that allowed due to COVID restrictions?
So clearly we do need to make some exceptions for people to be able to do that. But if she was accompanied, the same social distancing requirements would apply as with any other person. But yes, she would be able to attend with someone.
And do people who have had the virus already still need the vaccine?
Yes, it's the same as flu in that sense. You know, the chances of someone, we don't know enough around the virus yet. I mean, Liz may want to comment. We don't know enough around the virus yet to see when if it would come back. So our advice would be, if you fit within the groups, you should get the vaccine, even if you've already had the virus. And that would be the same when we move into the general population.
Liz, anything to add?
No, I totally agree, David. That is the current advice, yes.
So at this stage, I think we can move on to another area of questioning and bring in Simon Wellman, who's he thought he might have got away with it today, but we'll bring him in. He's the Director of Education for Telford and Wrekin Council, and we've had some questions regarding schools and schooling. So Simon, good afternoon. We'll bring you in on this. And schools are only open to key workers' children and vulnerable children, which the questioner fully understands. But why is that rule not being applied also to nurseries and early years settings?
Thanks, Chris. So really want to acknowledge that, you know, we've been through a huge change, and it's greatly impacting on families, children, young people. The situation clearly changed very quickly last week. And I really do want to thank everybody, residents and schools also, while we worked our way through the changing government guidance. Just to clarify and just to make sure that we're clear, yes, schools and colleges are only open to those children who are vulnerable and those children who have got parents who are critical workers, key workers. But it is slightly different for early years settings where they're open for all. Essentially, we are following the government guidance there. And we understand that whilst all of the children are present, there's a real need and there is a real desire to make sure that our risk assessments are up to date, that we've got all of the suggested controls in place, and that the environments are as structured as they possibly can be. I think, like all areas, there's a real balance in how we manage as we work through the pandemic. There's an absolute need at the moment to limit social contact, but there's also that need to be mindful of well-being of our young people and our families to make sure they get a fantastic, great start in their education. And constantly we're having to play that we're making that decision in terms of what fits best. So yes, at the current guidance, government guidance, is that early year settings are open for all.
Shaun, you wanted to say something there?
I'm going to just associate myself with Simon's comments around our thanks to our fantastic schools across Telford Wrekin, our teachers, governing bodies, parents and children and young people. I think it's really important to put this into context in that our schools received a set of guidelines on New Year's Eve. Around 6 p.m. on New Year's Eve with some guidelines, and then the country found out alongside schools that schools would be closed, and guidance therefore was reissued. There's been a number of different sets of guidance in regards to what makes a vulnerable child, and there was even some new guidelines over the last 48 hours in regards to key worker children and what should happen to those children when their parents aren't working. So this is a really changing feast, and I think it's really important that everybody knows just how hard our teachers, our educators are working right across Telford Wrekin, because it's a really difficult challenge. And these guidelines, it sounds easy, doesn't it? But these guidelines are often pages thick with lots of technical detail. So as the guidelines are changing from the Department for Education as part of the government, our schools are responding. It may very well be that we just need to keep our eyes open in terms of the nursery provision, because there has been some chatter nationally around that over the last 24 hours or so, and I wouldn't necessarily rule out another U-turn from the government on that particular provision.
A parent asks, why has my daughter been told that if she keeps her 4-year-old daughter at home, as we have been asked to stay at home, she will lose her nursery place?
So in short, I'm not sure. What I would suggest though is if that is happening, then please do go back to the setting and ask the question, because clearly the message is that where possible, children should be at home. So if that is happening, please do, and you're not getting a clear answer, get back in contact with the local authority. For early year settings, I've got an email address, and it's talkingchildren@telford.gov.uk. That's where you've got queries around early year settings. Again, if you've got queries about school provision, please in the first instance go back to the schools themselves, but where you feel you need to, you can get back in contact with the council, and for schools that's school.covid@telford.gov.uk.
There's a question here from a key worker who is working from home 3 days a week. On the other 2 days of the week, the child is going to school by the look of it, but what about the 3 days that the key worker is working from home? My child's school is saying even if I'm working from home, he should still attend on those 3 days.
So again, I think I'll reflect back to what Shaun was saying in terms of the amount of government guidance that educational settings received last week, and there's not enough clarity in there for us at times. Clearly, I'll say the message again is that, where possible, children should be at home. So what we would ideally want is a flexible offer where that's necessary, that suits a family context. So again, please do go back to your school setting. But if you need to, you can get in touch with local authority using the details I provided earlier. I know we put that online as well.
Why is that despite the stay-at-home advice that I'm faced with my 4-year-old losing her nursery placement due to the lack of government funding, says this questioner. Can the council offer any further information on this? I want my daughter at home, yet she could lose her place indefinitely if I do not send her to school or to nursery.
So Chris, this sounds very similar to the earlier query that we had in, where essentially nurseries are asking children to attend, otherwise they might lose their place. Again, I do think that this is related to their funding, but there is things happening there from the national government in terms of early years funding. So please go back to the setting, and if you're having problems, again, get in contact with us and we can have those conversations with settings on your behalf.
A question from an early years manager who's worried about themselves and their staff because it's impossible for under fives to socially distanced. And they're saying, can the government provide scientific evidence on the risk implications of early years and childcare practitioners and data on current transmission rates in early years? I know it's not really one for you to answer, but This is what they're asking.
What I can do, Chris, is I can absolutely, we have daily contact with the Department for Education, and these queries that come through from schools, from settings and from parents are things that we can go back to them and make representation. And what I would say, and I just want to make it clear, is that there is that availability for testing for all staff in educational settings at the place, and that offer has been made before Christmas. So please do use that.
And perhaps if I come in there, just in terms of usually the infection rates are lowest in primary and early years on under fives in terms of at a population level. So infection rates are lowest in those particular age groups.
A question from someone who admits they are very confused. We are getting very mixed messages from school and the government about who is eligible to come in and who isn't. I'm now on furlough until the end of January, but my husband is a key worker, so won't be sending my children back. But I feel like the school want to get more children back so they don't have to do remote learning. Isn't the message to stay at home if you can, even children of critical workers?
So Chris, absolutely, yes. Our message is that where children can stay at home, then they should do. The children who really should be in school are those that are in that vulnerable category. But where a child has a parent who's a critical worker, then where they can, they should stay at home. Yes.
And while we're talking and on the subject of learning from home, and this is now what schools are doing once again. Before we talked about laptops for learning and the council's work in distributing laptops, and I'm just looking across at the Secretary of State for Health press conference that's going on now. He's talking about the rollout, the continuing rollout of laptops for children. What's the state of play in Telford and Wrekin in relation to laptops? Does everybody that needs one have one? Do they all have the capability to learn from home?
Firstly, can I just say this is a real frustration of everybody within the council's political leadership and indeed schools. We were promised hundreds upon hundreds of laptops for our schools earlier last year at the height of the first wave of this pandemic. Those laptops took an age to arrive. They weren't going to be enough in any event. And then after that, the numbers were slashed and reduced significantly. And Simon will be able to give you the details of how many were promised and how many have been delivered. And for many schools, they are still waiting for them to be delivered. And that's why, as a council, working with our partners, we were able to provide over 300 laptops for our schools. And I know, speaking to a number of schools, that they've able to work with parents and companies and so on to try and bolster those numbers even further. And the whole point of the restrictions and COVID measures were that people were able to switch from physical learning to online and remote learning. Now, clearly that is most needed when you have a total lockdown, but also that is needed when children have to self-isolate because COVID is in the bubble. And that switching from virtual to remote learning should be as easy as a switch being turned on or off, and that hasn't happened here in Telford Wrekin and across the county. And I know that Councillor Shirley Reynolds, the Cabinet Member for Education, is right on this together with colleagues to try and drive these numbers of laptops. I know there's some being delivered over the coming days, but we certainly need more help from government on this.
Yes, sure, definitely. We do need more help and we do need more devices, absolutely. Increasingly, we have got business partners as well that are coming on board and charities that are offering their services. And again, more detail about that will be published as we move through this week. But clearly, the move to remote learning, the move to online learning is a real challenge out there, and we do recognise that. I know a lot of our schools have individually as well purchased devices where needed, but clearly that isn't an opportunity for everybody because their resources are only limited as well. But it's something that we're mindful of, something we're keeping a watch on, and something that we want to support further.
Why are some schools trying to reduce social contact in asking children of key workers to be kept at home if there is someone at home, which they say sounds sensible and reasonable, yet others are actively ringing parents to let them know that there is space in the school and their child can go in, yet they're not a key worker or vulnerable?
So Chris, I wouldn't recognise that. I'm very, very clear on the messaging that is going out. Where children can be at home, that they should be at home. So the only children that should be in a school or a college is where they fit the vulnerable criteria or where it's absolutely necessary is a critical worker. So I don't recognise where schools are doing that. But clearly, if there is an issue, again, please contact us using the details I provided.
A couple of questions about BTEC exams. Why are they still carrying on?
So BTEC exams, clearly there was a significant change in position last week, and the BTEC exams, the vocational exams that are happening in January, they have now got that providers are now being offered a choice as to whether to do them or not, but that's in consultation with the young people and parents themselves. So it isn't that they must happen, there's more of a choice going on there now.
I think that wraps up education for now, but Simon, do stay with us just in case any more questions come in while we're speaking. We'll talk about enforcement, and during the ongoing Downing Street press conference, the Secretary of State for Health, Matt Hancock, hasn't ruled out any further restrictions, but as we speak, we'll talk about the level of restrictions as they currently are. And the first question is, what is local? And this will be in the context, I guess, of what happened over in Derbyshire with a couple of women who drove in separate cars 5 miles to then go for a walk with a hot coffee around a remote beauty spot.
The problem, Chris, is that the government haven't been particularly clear on this. And what they say is that the journey should start from home and end at home using active travel. But
the difference is, though, isn't it, that in the spring of last year, they said you cannot drive in order to go and do some exercise. This time, it appears to be allowed locally, whatever local means.
Yeah, and as I say, there's no definition of what local means, and that's half the problem, really. I mean, I think most people would consider having to drive 5 miles probably not local, and I think people need to take a common sense approach to this, because ultimately, what the point of the rules is, and I'm not here necessarily to defend the government, but the rules around this is to ensure that coronavirus doesn't spread from one area to another area. And that's the basic principle. But I do think it would be more helpful if the government was able to sort of offer guidelines. I know that previously in the pandemic, there's been suggestions of, a time limit of 1 hour, for example, or in Wales, they say you can't leave a certain distance away from your home, for example, and that guidance isn't here really. But I do think there has to be also a balance to this, because actually getting out and about is very good for your well-being and your mental health. And therefore, going for a walk, if you're doing the walk in a COVID secure way by yourself or with others, but in a COVID secure way, that's really good for you. So we do need to get a balance, but I do think the government do need to provide some guidance, and the police need to take a common sense approach to that level of enforcement.
What are essential businesses? We could give a very, very long answer, but we could refer to a website that lists it from the government, because it's the government that dictates such definitions, isn't it?
Yeah, Chris, I mean, I think there's all the premises that we've come to know as essential. So the essential food shops, there's supermarkets, there's pharmacies, garden centres are now deemed to be essential, where we've talked about the difference between March and this lockdown. In March, that garden centres weren't deemed to be essential. We've got hardware stores and building merchants, petrol stations, automatic car washes you can use, and then we've also got places like for critical infrastructure. I think we've had questions about how can car manufacturers stay open. This is because manufacturers are deemed as essential, construction is deemed as essential, so businesses such as that can carry on trading. But there is, as you say, Chris, a big long list of premises that can open, that I think perhaps we can put that link in the Facebook chat and people can have a look at that.
Okay, so to the team behind this, if you can pop that into the chat, we'll refer you to that. A few what can you do about type questions. What can you do about supermarkets? The inference of the question is that it's a bit of a free-for-all.
Before Nikki answers the question on the current position, I think it's really important to say that I think nationally and locally, there's been a huge amount of concerns around supermarkets. And I think that supermarkets do really need to start tightening their act up significantly around COVID secure measures. For example, limiting the number of people coming into the store, ensuring social distancing is applied, making sure that cleaning takes place. And I think supermarkets, and there's been a national announcement by one of them today around some tightening of their measures, really need to get their act together. You know, they are in a very privileged position, supermarkets. They're multi-million pound, sometimes billion pound companies that are open whilst many other companies and businesses are closed, and therefore they have to take a moral standpoint in terms of ensuring that things are absolutely safe for their customers. And I think one of the things that often I get through from residents is around our powers for supermarkets, and I'm sure Nikki will explain just how we exercise those powers over supermarkets in conjunction with the police.
Thanks, Shaun. Yes, so to reassure everybody, officers from Public Protection have been visiting supermarkets throughout all of the lockdowns and when everybody could trade as well. Their officers are going regularly, they're discussing their measures, we're talking about the cleaning, we're talking about what they're doing to protect their staff. We're looking at their COVID secure risk assessments. We're looking now to do some joint visits with the police, because I think one of the concerns, and certainly Morrison's has taken this step today, that they are now banning people from their stores if they're not wearing face masks. The wearing of face masks within a supermarket is a police enforced power, not a local authority enforced power. But we have been going to supermarkets and we've been ensuring that they are complying with the COVID secure guidance. But if anybody, as we've said before, has got specific concerns about a supermarket not adhering to any of the guidance, or if they feel unsafe when they go to that supermarket, please email coronavirus@telford.gov.uk and we will visit on your behalf to ensure that the right protections are in place.
What about smaller shops which can't open properly, but they can offer a click and collect service? But the question is suggesting that there are customers in the shops.
If they are a food takeaway, so if they are a fish and chip shops, for instance, then up until 11 o'clock, then they can have customers inside the shop to collect their goods. If it is anything other than a food business, they should not be having people inside the stores. The click and collect should be sorted out so that the customers don't have to go into the stores. And again, we welcome the residents of Telford and Wrekin being our eyes and ears. We can't be everywhere. If you have specific examples and you want us to investigate, please let us know at coronavirus@telford.gov.uk.
And that's the email address, but also the Public Protection team have a website with a lot of information that you can refer to as well, and that is the www.telford.gov.uk/coronavirus. Should bus drivers be wearing masks?
Again, most bus drivers, I think, are sat behind a perspex screen. So the need to wear a mask if you are sat behind a perspex screen is taken away. If they're not sat behind a perspex screen, then yes, they should be wearing a mask.
What can the council do to those employers who are still asking their staff to go into work even though they can work from home?
Again, if you can give us specific examples, then we will talk to those employers so that they fully understand what they should be doing. It's if workers can work from home, they should be working from home, and we can help negotiate with those employers. If they're just to say, Chris, if they are a local authority enforced business, we've talked about this before, some premises are enforced by the local authority for health and safety, some are the health and safety executive. But if you come to Public Protection, then we will, if it's not one of our businesses, we will pass that information on for you to the HSE.
Question about parents taking their children to and from school, all gathering outside or gathering by the gates, no social distancing going on. What can be done?
Well, I know that, and I don't want to steal Simon's thunder, but I know that Simon has sent communications out to schools in the past about parents gathering at the gate, and I know that schools have taken some action on it. So Simon, I don't know if you want to come in on that one.
Only Nikki to say, yeah, we have sent out videos really promoting the social distancing measures that are needed at the school gate, and promoting parents also wearing face masks as they're picking and dropping off their children. And then what we will do is we'll reissue as well some of that communication that we sent before Christmas, just to reinforce that message.
It's also really important to note that the police have fined people outside of the school gate for breaching the rules of 6 and breaching social distancing, and the police here in Telford have got one of the highest levels of fixed penalty notices in the country. So, you know, a message very clear to parents: you know, you've got to follow the rules at the school gate as you would in the supermarket and out and elsewhere where you are.
Someone's asking, can they continue with the refurbishment of their community group building?
I think we'd have to look at that in terms of who was actually doing the refurbishment. If they've got contractors in, then construction is something that can continue. If it was being done by community volunteers, then I think we would have to look at that specific circumstance. So again, if they can send us some more information in, but if it's been done by contractors, then construction can continue.
This question's just come in. Why is this lockdown so different to the first one, when people stayed at home, the roads were empty and people worked from home? They say now the roads are just like normal. The Wrekin is packed with non-socially distanced walkers. I'm a key worker, train carers and work with the vulnerable, and still no offer of a vaccine, they say. So it's two-pronged. One is on the vaccination, one is on the lockdown. But as I said a few moments ago from Matt Hancock's press conference, which is still going on from 10 Downing Street, don't rule out further restrictions, he said.
I think the real important thing to say here, Chris, is that the lockdown isn't like March, because the government hasn't made it like March. It's more like November plus school closures. That's the reality. And when you look back to March, there was there were scores of businesses that were closed. Construction was closed, manufacturing was closed, the ability to move houses was closed. Now, I'm not saying necessarily that all those things would be right now, because we know much more about the virus and the control measures that can be put in place. But the rules that have been determined by London are different to March, and that's why you are seeing more people out and about, because they are going to work in the way that they used to. Because if you can't work from home, and lots of people in Telford Wrekin can't work from home because of the jobs that they do, they will be going in the car to work. So I think if you follow the commentary nationally, looking at ways in which to make the lockdown stricter, more like March maybe. But the reality is, this lockdown is not a March lockdown; it's a November plus lockdown.
And in terms of the enforcement part of that, just going back to the comment about supermarkets that Nicky Minshall was saying, and the visits that you'll be carrying out with the police to any premises, people are asking, what about the old one-way systems that were in place back in the spring of last year? What's happened to those? And what can you do to make sure that maybe they come back?
I think that is what it's very important, that we do the visits to the supermarkets and work with the branch managers. I think some of the supermarkets are looking at putting control measures in. I know that from my own experience of shopping at the weekend, that queuing and limiting numbers has come back in some of the supermarkets. I think that there is a national view now from government that perhaps supermarkets don't have enough controls in place. So I think that the team will be out there over the coming weeks looking at supermarkets and taking whatever action is necessary.
If I can bring David Evans back from the NHS Clinical Commissioning Group, the press conference at 10 Downing Street has just ended with the Secretary of State for Health. The main points saying that the government wants to vaccinate every care home resident this month, and it's also on track to meet vaccination targets, leading to a question that has just come in from one of our viewers regarding full-time carers caring for disabled family members. Where do they go for their vaccine? Or is it the previous answer that you gave, that they will be notified by letter or phone call?
So if I just pick up what Matt Hancock has said first, Chris, if that's okay, just in terms of locally, we will have vaccinated all of our local care home residents by the end of this month, in line with that commitment. That is our plan and has been our plan for some time. In relation to the specific question around full-time carers, they will be called for at the appropriate time. Now, I can't give a timescale on that at the moment because, as I said, we are trying to make sure that we protect the most vulnerable, and clearly if they have a disabled family member who's in their 80s, they are going to get called for vaccination. But carers, full-time carers, don't quite fit into that category, but we will get to them, and just wait for the call.
Dave, this is a question for me, but also on behalf of our viewers, because I know this is something that's come through a number of times. You may not know the answer off the top of your head, in which case we can share it later on. But when the government talks about care homes, does it mean all care homes, regardless of age, but linked to disability and other conditions? Because this is a real concern for lots of people. What is a care home in the context of this? And also, does it include, for example, extra care facilities? Because again, people are feeling very confused about what this term means.
So a care home, in the context of what Matt Hancock has just said, and how we are working at the moment across the NHS, not just locally, is a residential or nursing care home, particularly for the elderly. It's not for younger adults or not for people with learning disabilities. And in the same context, Shaun, it doesn't apply to extra care or supported housing. They are not care homes within that strict definition.
Just wrapping up, just a handful of questions remaining now, in a little bit random, in no particular order. I think we're going back into the world of enforcement again, so we'll bring Nikki Minchell back into this one. People who work in chip shops, should they be wearing face masks? Oh, Nikki's got to put the pound in the pot there.
Talking away to you, yes, they should
Yes.
be wearing face masks.
Talking away, muted at the time. Can you reason out the government's advice on learner drivers not being able to have private practice in England with someone from within their family bubble? And they refer to the guidance that's come from the government with a government link there. So, yeah, learner drivers.
The answer is, can I rationalise it? No, it is the government guidance. I think what they're probably referring to is within that guidance. In Scotland and Wales, you can practice with people from your same household, but I think the caveat is it has to be an essential journey. And I think probably the guidance in England is that learning to drive is not an essential journey, therefore shouldn't be undertaken, because we should only be leaving our house for essential journeys.
And just a reminder again that we can pretty much expect some sort of announcement from government very, very soon, certainly this week, on the tightening of those restrictions as well. This is quite a specific question. My partner and I are licensed radio amateurs, and because he's in a wheelchair, he can't really enjoy exercise. So what he likes to do is to get into the car and park on a hill and use his radio to talk to people all over the UK and the world. But they're not sure whether that sort of thing will lead to them being fined.
Yeah, thanks, Chris. We debated this one, and we totally sympathise with the two amateur radio enthusiasts, but we feel at this time it wouldn't be classed as an essential journey to go out to somewhere to get better radio reception. So we would advise them to stay at home. And there are some websites, Exercising at Home, and Scope UK, that have got some guidance for those with disabilities in order to enable them to exercise at home. So unfortunately, our guidance here would be no, we don't think this would class as an essential journey, and that to avoid any kind of fine, they should stay at home and not do it.
Bringing Simon Wellman back in, the Director of Education with Telford Wrekin Council. If anyone has concerns about a specific school and the hygiene practices around COVID, who should they report that to?
So I think in terms of any queries you have about individual schools, refer back to that email address that I gave earlier, which is school.covid@telford.gov.uk, and clearly we can then go and speak to the school. But just really to provide some reassurance, I know that all of our schools have got risk assessments that have been placed on their websites. They've got additional cleaning that is going on. So please feel rest assured that there is a lot happening out there in terms of the environments and making sure control measures are in place.
A couple of questions about small business grants. When are they next available and how do they claim them?
Okay, so the government have recently announced some additional new business grants that are available, but we are still waiting for further guidance. We're expecting that to be released this week. Having said that, we know a certain level of detail at the moment. So for businesses that have been forced to close due to government restrictions in the retail, hospitality and leisure industries, there will be a one-off grant available to business ratepayers.
And this is up to 10,000, isn't it? Is that right?
No, it's a payment of 4,000, 6,000 or 9,000, depending on their rateable value.
Right. I think that's why the media's summed it up as being up to 10,000 in that case. So it's
Yeah.
dependent. Yeah.
Along with that, there is an additional payment to those businesses for every 14 days that they remain closed. We know at this stage that businesses will be in lockdown for 6 weeks. So this week we'll be making a 6-week payment to them. We'll be emailing all those businesses that have previously applied to us and received a grant. So we'll be making payment hopefully this week and emailing all businesses this week. Full details are available on our website, and also there's the discretionary business grant scheme as well for businesses that haven't received any other business grant support.
And what happens if you're a trader at Wellington Market? What funding is available for traders that have to stay open, but they're not getting the normal sales that they normally would?
So there are two types of businesses within Wellington Market. Some are business ratepayers and some aren't. So we class them in a shared space. So there's a mixture. Some of those will fall into a business that's previously received a discretionary grant from us. If they fall into that category, we'll be making duplicate payments to those businesses this week, and we'll be writing to those businesses to let them know. If they're a business ratepayer and they've been forced to close due to government restrictions, again, that falls into the lockdown payments that I've just detailed.
And that, I think, sums up all the questions. Thank you to everybody who has watched, and thanks to everybody who was asked. And I'll leave it to our guests to have the final say, if anybody should wish to. David Evans, you're the star guest on this one. Thank you for taking part in this and answering so very honestly, openly, and candidly. How is it looking for the health service locally? Certainly for maybe these next 2 weeks that Chris Whitty has said will be possibly the worst in the history of the NHS.
It's going to be a very difficult 2 weeks, Chris. And you know, the only message I'd really want to give people now is please follow the guidelines. Please stay at home if at all possible. Please do everything you can to keep yourself, your family, your loved ones safe, because notwithstanding the vaccination, that is the only way we are going to get on top of this and protect the NHS and all of our other crucial services.
And Councillor Shaun Davies, leader of Telford Wrekin Council, anything you want to say to wrap up?
Well, I'd echo that, Chris, and I think it's really important that for our neighbours who are working in the NHS in our local hospital, we owe it to them. We can't, on the one hand, clap them on a Thursday evening and not follow the rules on a Friday morning, because that is just completely disingenuous. And the other thing to say is that often the vaccine, we know you have to have two jabs to make it fully effective in the way that it is, but that still doesn't stop you having COVID in your system. We do know it takes up to 2 weeks for COVID to work your way through. And what a shame would it be if you were the one who got COVID just ahead of these vaccinations being rolled out. So we need the vaccination program to work. We need it to roll out. We as a country, this is a national mission. It's probably the biggest mission in post-war history of this country. We absolutely need to pull all the stops out to get the vaccination into people's arms. But equally, we do need people to do their bit too. And their bit is to follow the rules. Stay at home where you can. If you can't stay at home, make sure you follow those rules and look after one another. Some of the rates now in the country are 1 in 40 people have got COVID in certain parts of the country. We're not in that position yet here in Telford Wrekin, but we could easily be in that position. So we absolutely need to look out for one another. And just finally, Chris, if I can say, because the council shared a very personal story on our Facebook page today of COVID. It just so happens that I went to school with Shaun. Shaun, my age, telling her story about how she's been admitted to hospital because of COVID-19. 34 years of age, a mother, and somebody who didn't think COVID would impact as hard as it has. Read her story. That could be you.
Councillor Shaun Davies, leader of Telford Wrekin Council, thank you. Also to Nikki Minchell from the Health Protection Hub at the Council and also from Public Protection. Sophie Lane, Revenue's Service Delivery Manager. Liz Noakes, the Director of Public Health. Simon Wellman, the Director of Education. And David Evans, the Joint Accountable Officer for Telford Wrekin and Shropshire Clinical Commissioning Groups. Thank you for your contributions to this. Thank you for watching. Thank you for your questions. Ladies and gentlemen, thank you for your answers. From me, Chris Kowalik. A very good evening to you.